Good morning, friends. According to the American Urology Association 2018 guidelines, all men with erectile dysfunction should be offered penile implants. So, when a patient with erectile dysfunction comes, any type of erectile dysfunction, we should offer him all the treatments, medicines, vacuum therapy, P-shot, shockwave therapy, intracavernosal injections, and penile implants. We should explain all the risks and benefits of all the things. And once patient has understood all the treatment options, their risks, their benefits, and after that, if he is motivated for penile implant, then definitely we can offer him penile implant surgery. Now, which implant we have to choose depends on the full understanding of what is a penile implant, how does it work, and how do the different penile implants work. First of all, I'll tell you how the penile implant works. So, you imagine that somebody during intercourse wants to insert a finger. So, they can insert the finger in the vagina because the finger has got a bone inside which gives hardness. Now, this hardness helps in penetration of the finger into the vagina. A person with erectile dysfunction is not having a hard erection, so he is not able to penetrate. So, when we put an implant, implant is put inside the penis which gives hardness, and because of the hardness, patient is able to penetrate. So, it helps in the intercourse. The intercourse is totally natural intercourse. Your normal blood flow will maintain, the urination will maintain, the urination stays normal, the semen discharge stays normal, the normal blood supply is maintained after the implant. You have to understand that penile implant surgery is not for enlargement. It is for erectile dysfunction treatment. It does not increase the length of the erect penis. So if some patients come for enlargement of the penis, penile implant is not the treatment option. Now, once you've understood what a penile implant is, there are two types of penile implants. One is the malleable implant and one is the three-piece inflatable implant. In malleable implant, there are two rods which are put inside the corpora and they give support to the penis and help in the erectile dysfunction treatment. So, it's a simple implant, just two rods are placed inside the corpora. In three-piece inflatable implant, it has got three parts. The two penile cylinders like in the malleable implant, along with that a scrotal pump and a retropubic reservoir. So, all the time water is there in the retropubic reservoir, and whenever the patient wants to have intercourse, they squeeze on the scrotal pump and water from the reservoir goes through the pump into the penile cylinders and gives an erection, and then the patient can have intercourse. After intercourse, again press the pump, the penis shrinks like normal and the water goes into the reservoir. So, three-piece inflatable is a very natural type of implant in which the erection mimics a natural erection, that hard at the time of erection and totally soft and shrunken at the time of not having intercourse. Now, how to choose between a malleable and an inflatable implant? First of all, I will tell you what are the contraindications for an inflatable implant. So, like I explained you that you have to press the scrotal pump and then only the erection will come. So, somebody who's got poor hand dexterity, that means that the hands are not able to move properly, probably he's got a stroke of the upper limbs, his hands are weak for some reason, or he's so fat that his hands cannot reach the scrotum. So in all those things, he will not be able to operate the three-piece inflatable implant. So three-piece inflatable implant is not for a patient with poor hand dexterity. The other thing is the cost. Now, most of the time, implant is not covered by insurance in India. And for that, out of the pocket, such an expensive implant, everybody is not able to afford. So just imagine if you want to buy a car to go from your house to your work. You know about the Rolls Royce and you know about a Honda and a Toyota also. If you have a budget, you go for a Rolls Royce, but if you don't have a budget, you go for a Honda or a Toyota, and you're happy with the car because it's able to do the function of going from the house to the office. So again, if your budget is not enough, you cannot afford an expensive three-piece inflatable, the work of a Honda Toyota, the malleable implant will do. It's a simple implant, just two rods are placed inside the corpora. Now when you're looking for an implant, you have to look for certain characteristics because it should be a successful surgery. The first important thing is when you have an implant, what will be the hardness? After implant, the hardness of the penis should be good enough for a successful intercourse. Studies have shown that the pressure on the penis of about 1 pound is required for successful intercourse. So if the penis doesn't buckle with a pressure of 1 pound, then you can have sexual intercourse successfully. The tactra implant has been tested in the lab, and it has been shown that even a 5-pound weight does not result in buckling of the penis during intercourse. So it's a very good implant, rigidity is good. This is because it has got nitinol core, which is nickel titanium alloy, which gives good rigidity to the implant. So hardness is one criteria. There are some patients who come to me and say, I want a strong implant, hard implant, because I am young, I like woman on top position, the cowgirl position, and tell me an implant where I can do a cowgirl position intercourse, or tell me an implant where I can do an anal intercourse. So when you're wanting these type of good erections, hard erections, then tactra implant is a very good option. The second point is the concealability of the implant. The tactra implant has got an articulating zone, because of which we can conceal the implant. We can bend it almost 90 degrees, and it has got a memory. So when you bend it, it doesn't spring back. So patients come to me that I want a malleable implant which is concealable. I work in a corporate office, I wear loose clothes, it should not be visible under the clothes. So in that case, the tactra implant is a very good option because it can be easily bent under the clothes and people outside will not be able to find out that if you're wearing an implant or not. The third thing is a natural feel. When you're having intercourse, you should not feel pain, your partner should not feel pain, you should not feel that some stony thing or a hard thing is getting inside the vagina. You should not feel unnatural, because then it will not be a pleasurable experience. The tactra implant has got 2 layers of silicone coating. Silicone is a metalloid. It is a very biocompatible material and it is between a metal and a non-metal. So the consistency, when you press the implant, it feels firm to hard. It doesn't feel a bony hard or a stony hard. So this gives a very natural feel after the implant is placed inside the penis. The other thing is it has got a soft round tip, and this soft round tip helps in seating the implant comfortably inside the glans, and during intercourse there is no pain to the partner or to the patient. So if patient does not want to tell his partner that he has got an implant, if you are having intercourse with the malleable implant, it is a totally natural feeling. The partner would not be able to find out if the intercourse is because of the natural erection or is it because of the implant. So it is a very natural feel. The fourth very important thing is the durability. You don't want to get a penile surgery repeatedly. So many patients ask me that I'm young, I want an implant which stays lifelong. So these malleable implants and the inflatable implants both have a long duration. They have a long life. They don't have an expiry. It's not like after 10 years you have to get them changed. So if they're working fine, they can be used for lifetime. The tactra implant has been tested in the lab that it has been bent 1 lakh times up and down like this. And even after 1 lakh times, the bending capacity of the tactra did not get spoiled. And this 1 lakh times is equivalent to almost 20 years of life. So at least for 20 years after putting the implant, nothing happens to the implant and it's working fine, it's functioning fine. So these implants have a long life and you don't have to worry that you'll have to get the surgery repeatedly. So in short, like these malleable implants, they are easy to use for the patients. They have lesser chance of infection because of less parts, and the cost is much lower. So if you are having a budget issue, then this is a good choice. In the end, I would like to tell you the 3 things which I have been telling in this talk. First of all, penile implants are now the first line treatment for all erectile dysfunction patients, especially if they understand the risks and benefits and they're motivated for penile implant surgery. Secondly, the 3-piece inflatable implant mimics natural erection and it's a very good implant. Thirdly, for patients with budget constraint, malleable implant is a very good option. Thank you.